Hey guys, welcome back to Contest Prep University. I'm Joe Klemczewski with Adam Atkinson. We're in episode 5 of our series on PED use for female competitors. And I am a health scientist, Adam. So even though I mentioned last time that I wish these things were legal, I wish we could use them for all kinds of health reasons. My home base of knowledge is simply with TRT and HRT for men and women who are approaching their 50s and 60s and so forth. So I see a lot of health benefits from the use of these compounds, and I know that they can obviously be even helpful for other people at other points of their life. Obviously, we're talking about the use in sport, specifically physique sport right now, for the development of strength and hypertrophy. But just to kind of end this series on how you might advise people cycle for health reasons, and then maybe even health considerations to watch for, where you have to involve a primary care physician or somebody to help you monitor things that you're not even aware of.
Yeah. Well, there's a few things I like for just self-monitoring for women. So obviously you have more receptors in the throat and the clitoris for women. It's actually not a bad idea to take a measurement down there, and they can keep that to themselves, but just keep an eye on that. But there's actually a voice recording app. It's a decibel measuring device. So it's called Google Voice Analyzer, and you can actually record your voice every week and see if it changes. Because when we talk about health, like likely your doctor is not going to do those two things. So those are like more personal health monitoring that I like to bring up to people. And then second, obviously getting lab work done and seeing, where your liver enzymes doing, kidneys, endogenous hormones. And then you kind of wanted to go into like TRT and managing that.
We can get into that. We're going to do an entire series on men. So, I just wanted to say that's where kind of my knowledge begins and ends.
Yeah. So, but you can even do private lab, but even when my clients do private lab, they send it to me and I look, but at the end of the day, you don't want to bypass medical care. So when my clients get these private labs, I tell them to mail those to their doctor, because you might be due for a colonoscopy. And if you're just out getting your blood work done without your doctor's supervision, they might miss telling you that you're due for a colonoscopy. And you really do want medical attention all the time, and a expert looking at your stuff. Now, a lot of times doctors aren't necessarily inclined in hormone use, so they might refer you to an endocrinologist to watch over you as well. But you really can't put a price on self-care. And it's really important to be with the right type of doctor who maybe works with physique athletes, or at least monitors them. And you can even go to a hormone clinic that's a little bit more familiar with this stuff, and get some advice as well.
With the kind of use we're talking about for bikini and figure competitors, where you may have Anavar, Primobolan, maybe something else, but still mild. You're staying away from virilization and androgenic compounds. Will you typically see ALT and AST liver enzymes rise, or will you see red blood cell counts go up, which could be a concern?
Yeah, you will see and even like a swing in cholesterol as well. So these are all things that we want to look out for. And yes, you can combat some of those side effects with supplements, but that doesn't mean that you just keep using and tower those supplements on top of it so you can use longer. You definitely want to break from these compounds. And the last thing you want to do is be on a statin to lower your cholesterol because you're taking an exogenous compound.
For a female competitor, have you seen, Adam, that let's say they do use something like Anavar for 16 weeks off and on for prep cycling, and however they will, and then they go off? Is there some kind of super low endogenous production now? Does their normal testosterone perhaps go from 20 nanograms per deciliter to 5? And do they encounter maybe some true depression? Like what's that like?
So if they're getting the labs on, we're going to see elevated androgens. If we get it right after, you might see a little bit of suppression. So with women, their progesterone levels going to drop some because it's sensing that you're taking in a hormone. So why create these endogenous hormones? So there always is a little bit of suppression. The difference with females is typically the dose is so much lower that it doesn't affect the endogenous as much as it would a male. And that's kind of the big difference. But you will see those swings in the lab work for sure.
Okay, awesome. Well, guys, we wanted to cover some things that we thought would be question marks for people who just don't know anything about this world, or maybe you're getting your information just from coaches or from the internet without a lot of expertise. So I hope this is helpful. We're going to plan on another series for men specifically, and then another one with some of the odds and ends that maybe cross back and forth between male and female use. Not all typically just anabolic compounds, but some of the things you hear about like T3, clenbuterol, things like that. So again, very out of our norm for Contest Prep University, but what a worthwhile topic just to make sure that people at least have some knowledge. And I hope it really prompts you to look even more for the correct knowledge. So thank you so much, Adam, for all your contributions and expertise. We'll see everybody next time in Contest Prep University.